Now, if you're someone with a history of a total knee replacement and you have desires of getting back to the gym again, then stay tuned. Now, I'm a physical therapist that have treated many patients right after knee replacement, and many people have gone through the normal process of doing their rehab exercises, but after about 6 months, they have the common question of what next? Can I go back to the gym again? Is it safe to be lifting weights? Which specific exercises should I be incorporating? These are common questions that many of my patients ask, especially people who are very active and want to get back to doing the things they love. Well, in today's video, I'm going to show you that it is safe and actually required to be adding in some sort of progressive exercise into your routine, as well as go over the 7 must-do exercises that you must use in order to build optimal strength. My name is Dr. Mike, and I'm a physical therapist who creates videos on showing people how to build strength and longevity with your body. If you find value in any of the videos that you watch, to show your support, please hit that subscribe button below. Now, before we dive into the 7 most critical exercises that you must be including if you plan on returning to the gym, we must go over the qualifications as well as the parameters for this type of routine. Number 1 is how often are we going to be performing this routine? 2 to 3 times a week is going to be key in order to build optimal strength in the surgery and the non-surgery leg. Anything from 5 to 6 times a week is just a little bit too excessive, and 1 time a week is not enough to actually build strength. So 2 times a week is going to be key. Now, the next thing you should consider to identify if you are ready for this type of program is understanding where your current pain level is at. In order to participate in a resistance training program where we can add on weight each week, you want to ensure that your pain levels from a 0 to 10 are anything from a 0 to 4. If you are ranging from 5, 6, or even 8 out of 10 pain, you are going to have difficulty with these exercises. So let's ensure that you keep those pain levels low before you start this program. Moving on to the next question that I know many of you will have. How many sets and reps are we performing? With all of these exercises, we want to shoot for 2 to 3 sets of anywhere between 12 to 15 repetitions at a time. At that specific rep scheme, that will allow you to build strength over the next couple weeks and will allow you to really develop great movement patterns with these exercises. Now, the last thing you want to consider with this specific program is that you want to continue to focus on your range of motion. Flexibility is going to be key, especially if you're someone that has stiffness in the knee, and it's important to continue to work on your stretching throughout the week as you're focusing on this strengthening program. Now, if you want more tips or more ways to learn how to stretch that knee out, I've made a video here where you can check that out and you can implement some of those stretches that I went over in this video into this routine on your own time. Now, let's get into the first exercise that is going to be most beneficial for you, and that is cycling. When you get to the gym, the first thing that you should be working on to help loosen up that knee and start getting it ready for movement and exercise is jumping on a bike. The reason why I think this particular machine is helpful is, unlike walking, where you're just walking on a treadmill and not really stretching out your knee, the bike will give you an opportunity to take your knee through some flexion and extension. That's bending and straightening as you're participating in this exercise. I normally will recommend patients to start with anywhere from 8 to 10 minutes at a time, and you're not going at high intensity. This is just an opportunity for you to loosen up the knee and get it warm as you get started with your strengthening program. One thing that I want you to consider before jumping into this specific exercise is ensure that the seat height is high enough. If you have that seat height too low, it's going to force your knee into more bend and flexion, which is not going to feel comfortable if you're just starting off. Now, the next exercise that we're going to move on to is the leg press. This particular machine is one of my favorite, especially for beginners that are just getting started with strength training. This is a great exercise specifically because you are sitting and you are supported by the pad. So unlike a squat exercise, here you're allowed to be supported with your back and your neck, and you can really control how low you want your hips to set down. Typically, there are some settings on the machine where you can start with your hips a little further beneath you, but essentially you're working on a supported squat and allows you to get some good bend in the knee. Now, the next exercise we're going to move on to is a goblet squat. Now, if you're someone new to squatting, you can actually perform this by sitting back into a bench or into a chair. But the reason why I like the goblet squat in particular is because now you get to add some weight and train your core muscles at the same time. So you're essentially separating your feet about hip width apart. You're taking some sort of equipment like a kettlebell or a dumbbell, and you're holding it close to your chest, and you're essentially going to sit back into a squat, go as far as you can, and then you're gonna stand back up. This is a great exercise to build strength in the quadriceps and the glutes. And obviously, to make this more challenging, you can continue to add more weight by using a heavier dumbbell or a heavier kettlebell. Now, the next machine that is going to be critical in helping you build strength in your knee again is the leg extension machine. This is a great machine to help you isolate the quadriceps. And really, once again, like the previous machines, you are supportive sitting down, so it tends to be very easy for people to perform. Just ensure that when you are setting up, that pad located near their shin is all the way at the bottom near your foot. If it's too high, it's going to be very awkward when you start to extend your leg out, and it's going to be difficult for you to have full range of motion as you straighten your leg out. Another thing to consider here is you want to start off very light with this exercise. Just like we talked about in the beginning, 12 to 15 reps is what you should be completing on both your legs, 2 to 3 sets. If you find that you're struggling with 7 or 8 reps with your desired weight, just ensure that you drop that weight down and really focus on full range of motion. We don't want to irritate the knee. We're just trying to get some strengthening done in a greater range of motion. If you do have access to working your legs one leg at a time versus 2 legs at a time, I'm always a big fan of unilateral training. This will allow you to identify the weaknesses between your surgery and your non-surgery leg. All right, moving on to the next exercise, which is calf raises. Now, many people that have had this type of procedure are constantly just focusing on their quads. Like, this is the only muscle that they're training to help get themselves strong again. But little do they know that the calf muscles are actually very important in developing stability behind the knee. So the calf raise exercise, where you can be supported underneath this type of machine here, you can really focus on allowing your heels to come off that step and allowing a good stretch in the calf, as well as a good contraction as you go up on your tippy toes. The key here as well is full range of motion. We should not be cutting that range of motion down. Let your ego out the door. Forget about how much weight you can do, but focus on full range of motion. You're gonna notice that you're probably gonna get quite sore while you're working on this exercise. And this is also a great way to facilitate getting back the straightening in your knee. Now we're gonna get into some more advanced exercises. And the next exercise that I think is extremely beneficial for this type of procedure is a dumbbell Romanian deadlift. Now you can do this with kettlebells, but I'm in this video showing you with dumbbells. And what you're simply going to do is stand with a pair of dumbbells and work on having a slight bend in your knee, and you're gonna hinge and bend at your hips. This is going to allow you to get good strengthening out of your hamstrings, your calves, and most importantly, your glutes. As you stand up at the top, you're focusing on contracting those muscles, really focusing on that hip extension, and then you're controlling yourself down, keeping the dumbbells as close to your body. Another thing to keep in mind here is what I'm focusing on is keeping a tall chest. This allows my back to stay erect and straight versus allowing myself to round at my back and risk myself from hurting myself. You'll realize very quickly after 10 to 12 repetitions of this particular exercise, you are going to be definitely working your posterior chain, and it is going to be a great addition to your strengthening program. Now, the last exercise that I'm going to show you here that can be critical in helping you build that single leg strength again is by adding in some Bulgarian split squats. This is essentially when you bring one leg behind you on a bench or on a surface, and one leg is staggered in front of you. You have a pair of dumbbells or kettlebells in your hands, and you basically lower yourself into a single leg squat. This is so important for single leg strength. This is gonna work your quadriceps, your hamstrings, and even your glutes. And you're gonna definitely feel how much this actually challenges your balance, which we can't forget about how important that is for general rehab and full recovery back to normal. If you find that this exercise is just too challenging, I have created another video that talks about the split squat and some great alternatives with this exercise. So I'd highly recommend that you check out that video there. And then once you develop the balance and the strength with the split squat, then you can progress yourself to this particular variation of the split squat. Those are my 7 go-to exercises that you must be incorporating, especially if you're someone that wants to return to the gym, as well as someone who wants to continue to build strength in your surgery and your non-surgery leg. Now, just consider with this specific routine, results are not going to happen overnight. It's going to take consistency and practice for you to actually see maximum results here. Now, if you want more information on how to heal and recover from this specific procedure, make sure to check out my playlist here on my channel where I go over many videos on how to improve your range of motion and your strength. Otherwise, if you found this video helpful to support my channel, please do me a favor and give this video a like and subscribe below. I'll see you in the next one.